Okay, I think we're set to go here. Thank you very much, Catherine, for that introduction and for extending the invitation to me to present on some of my postdoctoral work here today that I did with the Center for Research on Work Disability Policy and finished just over a year ago. And as Catherine mentioned, I'm in a new role now, a different role, sort of in the field of primary healthcare research. So I'm very happy to be presenting these findings with you all today. And I look forward to hearing some of your thoughts on some of the issues I present, particularly amidst all of the change we've been experiencing in this past year. So just as a quick outline for what I'll present today, I'll start with a brief background and rationale for the work that I did. And I'm going to take a moment as well just to tell you how I think about some of the concepts that I'm using, just so that we're really clear on what I mean by work mobility and work disability and so on. And then I'll present to you some of the key findings from the two components of my postdoctoral work. The first phase was a scoping review, which I will cover fairly quickly. And the second phase was a qualitative study, which I'll spend a little more time on in terms of presenting my findings. So the goal of my study was really to broaden understanding of how we can improve the labor engagement of people with disabilities. And so in Canada, we know from the available research and from the most recent survey, the Canadian Survey on Disability, which was done in 2017, that people with disabilities are more likely to be living in poverty and less likely to be employed than those without disabilities. So we're looking at about 59% of working aged people with disabilities are employed versus 80% of working age Canadians without disabilities. And those with disabilities who are employed are more likely to be working part-time and are more likely to earn significantly less than their counterparts without disabilities. And moreover, the 2017 Canadian Survey on Disability determined that 40% of Canadians with disabilities who were unemployed in 2017 had the potential to work. So this means that when they were surveyed, they said they would be looking for work in the following 12 months. So they therefore weren't retired or entirely prohibited from working due to the limitations of their disability. So that's almost 645,000 Canadians with disabilities who could be working with accommodations or under more inclusive conditions, but who are currently, or at least in 2017, were unemployed. The work and health literature also links unemployment or underemployment with a higher likelihood of mental health problems, which are often associated with financial hardship, lack of social support, and a perceived loss of control. And similar consequences have been documented around work absences for those who are off work for work-related injuries or illness. And some of those consequences include worsening physical and mental health, strained and damaged relationships, chronic disability, and financial hardship and poverty. Conversely, of course, the work and health literature also suggests that the engagement of injured workers and people with disability in work promotes recovery and rehabilitation and improved health outcomes. As well, it can lower the risk of long-term incapacity and limit related physical, mental, and social consequences. There are also, more societal level financial consequences of the under and unemployment of people with disabilities. So estimates suggest, for example, that the total income support for unemployed Canadians with disabilities is around $30 billion annually. And this estimate is expected to grow. So it's no surprise then that a significant amount of a significant amount of policy and research efforts are dedicated to improving the labor engagement of people with disabilities. And a lot of this includes really excellent work coming out of the Return to Work Policy and Practice Partnership and CRWDP. But an important area of work disability prevention and management that's seen relatively little attention relates to the ability of workers with physical disabilities to travel to, from, and within the course of work. This work-related travel or work mobility can address employment issues by expanding the potential labor force for employers and providing greater job opportunities for people with disabilities and for workers in general. But work-related travel is becoming increasingly challenging and complex with the growth in precarious employment and the expansion of the transportation and construction and other highly mobile sectors. Not to mention the rising costs of housing in urban centers where work tends to be concentrated, which forces those with lower incomes, like injured workers and people with disabilities, to live outside of those hubs and to have to travel further to get to work. A growing body of literature on work mobility, much of which is coming out of the On the Move partnership, is identifying a vast array of challenges associated with mobility, which include significant physical and mental strain on workers and their families. And these challenges may be especially problematic for or exclude work-disabled individuals who have physical disabilities. So while work mobility is an integral part of accessing, carrying, and sustaining a job, work mobility research has shown, and as I will argue here today, that work disability research and policy largely takes for granted the accomplishment of work mobility and overlooks the related complex processes and features of getting to work that can pose unique challenges for people with disabilities. So my research then really sought to identify the ways that work disabilities and work policies and programs influence, either positively or negatively, the ability of people with disabilities to engage in work mobility. But before I go on, I just want to clarify how I'm thinking about some of these key concepts that I'm using. So in my research, I conceive of work mobility as the physical movement to, from, and within one's job. And I differentiate this from other ways of thinking about mobility, such as social mobility or economic mobility. And I conceive work mobility as occurring on a spectrum ranging from fairly minimal mobility, as with work from home, to local and extended daily commutes, to much longer forms of work mobility, including intra-provincial, territorial, and cross-country travel, as well as mobility within the course of work, one's workday. I focus this work on persons with physical disabilities, which limit persons' mobility either directly due to the concrete physical limitations or indirectly due to limitations associated with required treatments or medications and so on. I include in my notion of physical disabilities both work-related and non-work-related disabilities. And I also consider those that are continuous, intermittent, or episodic. And finally, I want to note that my research is framed by the social model of disability, which conceives it not as a personal or biological attribute of the individual, but instead as the situational outcome of the interaction between an individual with body or functional differences and a specific physical and social environment. So I'll take you now to the two components of my postdoctoral work, the first of which was a scoping review. And so, as Catherine noted in the introduction, my previous work, my doctoral work, had focused more on injured workers and their experience of the workers' compensation system. So my first step when I took up this work was to start with a review of the relevant literature to really generate an inventory of the issues related to work mobility and work disability policy, and to get a sense for the coverage of the literature in this area. So using methods of scoping review and the expert assistance of Kristen Rahm, who is a health sciences librarian at Memorial, my search involved searching the literature of 4 databases of international literature to find relevant English language sources from 1997 to early 2018, which is important to note because it was pre-COVID-19. And I used 5 key concepts or related synonyms, and I've shown those here on the screen. So I really was looking for the literature at the intersection of physical disability, accessibility, mobility, work, and policy. And the search ultimately yielded 60 relevant sources that I reviewed. And a topic that received significant attention in the review was factors affecting the work participation of people with disabilities. And these sources considered a wide range of social, educational, health, and environmental factors. And these studies suggest that people with disabilities who are more likely to be employed are those who have a higher education, have less severe disabilities, and who work in more professional occupations. So for example, those that require less physical labor and mobility. But that's really only to a point. And so some of the studies noted that where there may be promotions in those professional jobs that require increased travel, they may function to exclude people with disabilities. Factors that have been found to help people with disabilities engage in work include strong self-advocacy and resilience. So that includes understanding their benefits and supports and eligibility and so on. Other factors included job-specific training, networking, supports, and effective workplace accommodations. On the other hand, factors that came up time and again as roadblocks to employment include transportation-related challenges, difficulties with workplace accommodations, stigma and assumptions about what people with disabilities can and cannot do, as well as the employer's fears about the costs of accommodating people with disabilities. And the largest number of studies focused on workplace accommodations, so adaptations in the work environment that enable workers with disabilities to do their jobs productively and have equal opportunity for advancement. And these studies presented predictors of workplace accommodations being granted and the process for initiating and carrying out accommodations. Several of these sources examined accommodations of particular relevance to work mobility, such as work scheduling to accommodate unreliable or poorly timed transportation, work from home, telework, to eliminate transportation issues altogether, and supported commutes. But on the whole, these articles focused on accommodations that addressed barriers inside the workplace, rather than those outside the workplace that might help workers to get to work and between work sites. And when requested, transportation-related accommodations are the least likely to be granted and seem to meet the most resistance in court. And so the review of these sources suggests that commute-related issues are generally considered to be a personal responsibility. And interventions outside the workplace are argued to be inherently unreasonable and to easily qualify as undue hardship for employers, thus releasing them from their duty to accommodate. And in fact, one source called for a rethinking of reasonable accommodation and undue hardship so that we may conceive accommodations related to transportation as reasonable because they enable people with disabilities to get to work, and getting to work is an essential function of the job. So while work mobility was not explicitly studied in these articles, a number of the studies produced relevant findings, including the role and boundaries of personal assistance in the workplace, the utility of work scheduling or work from home arrangements to address transportation issues, inaccessible parking spaces, and the feasibility of supported commutes. And I highlight that this review looked at the literature up until early 2018. So it was performed pre-COVID-19. And so I imagine the literature about working from home is growing exponentially. And I'm hoping that it's capturing ways that it may be improving the labor engagement of people with disabilities. So key takeaways for me in the scoping review were that there was very little research, existing research, explicitly examining work mobility of people with disabilities. And much of the research in this area focuses on workplace accommodations and largely frames those in terms of barriers inside the workplace that might be addressed. Barriers outside the workplace, such as transportation-related issues, are framed as a matter of personal responsibility and are therefore conceived as inherently unreasonable and constituting undue burden for the employer. So then I moved into the qualitative component of my study. And just very quickly, the qualitative piece was grounded, theoretically in a structural interactionist perspective. So essentially that means that I conceive the individual experiences as well as the policy and practice related to work disability as socially produced, both through local level interactions between people, as well as framed by the broader social and institutional structures in which return to work and transportation to work plays out for people with disabilities. Specifically, this piece involved interviews, 5 with people with disabilities and 6 with key informants who have experience with developing, implementing, and or accessing the work disability policies and supports, as well as document analysis of human rights and workers legislation, policy, and case law in Newfoundland and Labrador. And I really moved between the interview data and document analysis to identify issues, policies, and practices that shape the work mobility of injured workers and people with work-related disabilities as well. So I'll get right into the findings. The first key finding really was that, through analysis of my interviews and key policy documents, that analysis suggested that work-related travel, even for those with physical disabilities, is often taken for granted and not adequately accounted for in policies and practice for both injured workers and people with non-work-related disabilities. So first, in terms of injured workers and the workers' compensation policy and practice, the system seems to overlook or not adequately account for the impacts of work-related travel. And we can see this in 2 key ways. We can see it through insufficient support for transportation to work through the return to work process, as well as through the travel challenges related to the return to work process, travel challenges that arise as a result of the return to work process. So first, there seems to be insufficient support for transportation to work from both the employer and the Workers' Compensation Board. So the system will generally cover, though not always, and sometimes only in extraordinary cases, the costs of, and they will help to arrange transportation to medical and assessment appointments, as well as to rehabilitation during the early and safe return to work process, when the goal is to get the worker back to their pre-injury employer. And when that does not work out, the Compensation Board may cover transportation to retraining, but there are constraints around that. So in Newfoundland, for example, the retraining must be more than 50 kilometers from the worker's home. But the support seems to stop there. So the system doesn't appear to recognize the cost or effort associated with an injured worker's trip to work, nor does it view it as something to be managed by the system. So this quote here from a key informant conveys how the workers' compensation coverage for transportation is perceived and experienced by injured workers. So when I asked what transportation supports are provided under workers' compensation to support return to work, this key informant says very little. The board kind of, at the end of a work transition plan and then the deeming, the board sees itself as out of it. And any kind of accommodations around transportation or even like modifications to the workplace that are needed to support somebody's mobility needs, that's the employer's responsibility, the employer's duty to accommodate. Where the board sees their responsibility is ensuring that the worker can make it to the work transition program. So if there's somebody in the north, in a little town, they have a community college program, but it's 2 hours away, the board will pay for their accommodation and transportation expenses while they're attending that program. But once the program is over, the board is out of there. So multiple key informants and people with disabilities noted that there's no acknowledgement of the fatigue and pain that may develop for a worker with a mobility impairment, with an injury that they're recovering from, after, for example, they undertake a possibly lengthy trip to work on public transit, or after they get their children ready for daycare and to school and doing multiple drop-offs en route to work. And these sorts of trips might be further complicated because they're now sharing a single car as a family because their income has been affected by their injury. And so this quote here illustrates, for example, say for single parents, they've got multiple drop-offs and they, meaning workers' compensation, don't consider that. I think they forget sometimes that the injured worker is injured. So to get everybody packed up and to get them out of the house and to make that first stop, they're wore out, right? And as this key informant notes, the Workers' Compensation Board tends to focus on what is compensable. And what is compensable is largely what happens in the workplace. And so the key informant notes the problem with focusing solely on compensable matters and only covering some transportation costs, but not others. And so they say, But the accommodations and the difficulty and the fatigue that may be occurring during transportation is completely ignored because that's not compensable. So their mindset is what is compensable, and what's compensable is the hours at work. But in terms of real working ability, in terms of a holistic point of view, the transportation to work is part of your daily fatigue. That's not considered at all, but it should be. And this key informant went on to note that there are in fact invisible consequences of a support system like this that covers some transportation costs, but not others. So you take travel to an assessment appointment, for example, at which the worker's degree of disability is determined. That might be arranged and paid for by the workers' compensation system or by the board. The worker might get a taxi to the appointment, have a fairly easy trip, and there they're determined to be about 30% disabled. And then the amount of work they can do is determined according to their degree of disability. But when they go to work and they have to get there on their own, on public transit, for example, that often requires walking and waiting or standing for long periods of time, all of which is made more difficult by their injury, the resulting fatigue and pain may cause them further impairment that hadn't been accounted for when the assessment, when their trip was easier. So if travel and its effects are not accounted for, workers may be expected to work longer and harder and take more complicated and longer trips to work than they are able. The second way we can see how mobility in travel is overlooked or not accounted for in the return to work system is in the way that travel challenges related to the return to work process can arise. Through, for example, the offers of modified work that require extended travel, or through return to work arrangements that might conflict with their transportation, their usual means of transportation, as well as through the travel implications of deeming practices and the associated labor market boundaries that the board defines. So a key informant, for example, told me about a woman who lived in a rural area and was injured at her job and was unable to find other suitable work where she lived. So she was offered modified work that involved a fly in, fly out, 3 week on, 3 week off type of arrangement. And that was considered acceptable when it was offered to her. And this is another worker who explains how the return to work process introduced travel challenges. He notes, he was sent to a different work location as part of his work accommodation, which was 2 hours from his original job. And his employer suggested that he carpool with other drivers to the new location. And he notes, like, I was pretty well stranded. I could get a ride there, and then I'd be told that I'd have to wait 8 hours to come home. And I'm only supposed to do 2 hours work. And this key informant, this quote here says more about the transportation challenges that can arise. And they say, it's hard to put numbers on this stuff, but I mean, it's very frequent that transportation is the main barrier to return to work because both workers, the employer will ask them to go back to a place that's further, the other workplace that's further away. But workers aren't able to use the means they used to use to get to work, or there's a new shift required or something. So, for example, their son won't take them anymore, or they can't take the bus with their injury because they have to do this and they can't do that. And the board says, that's not our fault. If you can do this, you should be able to take the bus. So transportation is huge. Another way the return to work process can introduce extended travel or travel-related challenges is through the deeming process. And many of you on this call probably know or certainly have heard the word deeming before. And this is when the compensation board determines that an injured worker has reached maximum medical recovery and is able to work and is employable in a designated kind of job that the workers' compensation board has determined is suitable and available. So this might be work in customer service, for example, or a job that was mentioned a lot was parking lot attendant, might be a job that someone is deemed as able to work and is available. And deeming practices assert that a worker is employable within their, quote, labor market, which could be a large region across which they are expected to travel to take up available work. So in the case of Toronto, for example, the labor market is typically considered to be the Greater Toronto Area, the GTA. So for some, that could mean a 2-hour trip on public transportation in order for the worker to take up suitable and available work, as has been identified by the Workers' Compensation Board. And so this here is a quote from a person with a disability or a work-related injury who's reflecting on having been deemed in a job. And she says, so they deem me to have a job I don't have, you know? They base their calculations based on work that I haven't and will not have, which is ridiculous. There's no way I can work a 40-hour week. I know it. I have to be careful not to crash. And this quote here from a key informant reflects on that labor market and how that's determined and how that can introduce extended travel for workers who are deemed employable. So I asked, in terms of deeming, are there limits around the length of a commute a worker would be expected to take on? And this person notes at the tribunal, at least, there certainly is, and it's ill-defined. But if it's a big center, and if it's a job like customer service rep, which is a fairly broad category, the tribunal might also say, well, there's customer service rep jobs close to your home in a city the size of Toronto. You can just go here, and that would be an hour's commute. And that's a normal Toronto commute. So they look at commuting patterns prior to the injury to sort of assess what's normal. So if you're commuting an hour or two prior to your injury, they would say then you're used to that and that's normal for you. But again, I remind you of the earlier issue of, you know, this doesn't account for the disability that the worker now has on account of their work injury and all the effort and fatigue that goes along now with taking this trip to work. And their old way of getting to work may not be feasible anymore. My analysis also determined that work disability policy and supports do not adequately account for travel-related challenges for persons with non-work-related disabilities. And I can see this in terms of a couple of the supports and programs that are available, including accessible transit, as well as the community supports that are available to persons with disabilities. So accessible transit may often be available, but it can come with restrictions and challenges that compromise its utility as a reliable form of transportation for work. It was noted, for example, that there can be variation in the availability of accessible transit. So depending on where one lives, it may not be available at all. And this person with a disability noted that in their hometown, which was relatively rural, there was no accessible taxi. And she notes, you know, in my hometown, they don't have an accessible taxi. So when I was living at home, my mom and I were getting very frustrated with each other because she didn't want me to bring everywhere. And I didn't want to stay home. So I would be like, Mom, I need to go to a job interview or something. And this other person with a disability notes that, again, the availability of transit affected their labor engagement. And they said they were offered a job in a nearby community, but because the accessible bus did not go there, they had to decline the job because they could not afford a regular taxi to and from that work. Where accessible transport, where accessible transit supports are available for people with disabilities, they may as well have some restrictions related to scheduling requirements, inflexibility, and unreliability that, again, really compromise their utility as reliable forms of transportation, particularly for getting to work. So I illustrate some of these challenges here in these quotes. So with regard to scheduling requirements, you know, this person with a disability notes that she talks about the cancellation notice that's required. It used to be 90 minutes, but now it's 45. But once you call to book your transportation, I suppose you gotta go. That's the problem with it. I make the booking and then I'm forced to go because I don't have the energy to cancel. You always have to be planning. Like I'm having to look in my fridge and figure out when I'm going to run out of milk. And they also noted that snow days can be really difficult as well, and they can make transportation to work extremely complicated. And so this person notes, if you get a snow day, I'm texting my boss, you know, can you tell me if it's going to be a snow day? Because I only have 45 minutes to cancel the accessible transit. And there were penalties. If you too frequently canceled within that cancellation period, you'd be penalized. And finally, in regards to the unreliability, this person with a disability notes that, in fact, on the day that she and I met for our interview, she had the bus booked for 8:30 and it didn't come till 9 o'clock. She says, I guess it's reliable most of the time, but sometimes they're terribly slow. And she spoke about having therapy appointments and scheduling her pickup for 4:30, figuring that would be plenty of time, but being quite late getting into the appointment and feeling extreme stress about not being ready when the accessible transit was there to pick her up. She talked a lot about the stress of being no-showed and the possible penalties for that. And the additional way in which supports and programs available to people with disabilities create transportation-related challenges is that they are means tested. So the threat of losing supports can impede the labor engagement of people with disabilities. So this person notes, I only took the receptionist job because I thought it would be a good entry-level job, but you could be there forever because you already have everything you worked out. And then when you do get a job that impacts your finances, it impacts your supports. So I had a job interview for 6 months for half of $50,000. But where I lived at the time, they said, if you make then $33,000 annually, you got to move out. And I thought, move out for a 6-month job? That's a bit stressful. And similarly, this person noted they had a work term making $18 an hour for 13 weeks and lost all of their supports, including getting their walker fixed, their wheelchair fixed, and having a personal support worker come in to help them clean and do their laundry and so on. And through my interviews and document analysis, I also found that informal supports play a critical role in the work mobility of people with disabilities and injured workers. And this is my second key finding. First, the system expects family or informal supports to help people with disabilities travel to work. And I could also see the way workers heavily relied on family supports and informal supports. And I put family here in quotation marks because it's a fairly broad notion of family here in this sense. So it's not just one's immediate or nuclear family. It's more broadly defined in that, and it can include friends and coworkers and others who sort of get pulled into that circle of support to facilitate travel to work. So in terms of system expectations of informal support, you can see that within the workers' compensation system. I heard from key informants who said there was an expectation that the worker's spouse or family member would take up the work of getting them to work or to various return to work appointments. As this person notes, for LMR, like for retraining and medical appointments, they just hated giving out things like taxi chits. I had these fights with the case manager who was like, he's the breadwinner. His wife should drive him to work, because they didn't want to pay taxis and they wanted his wife to change her shifts to take him to his training. This person also notes, it's not like, they're giving this transportation support. Like if an injured worker can't make it there, say, they're a one-car household, they see it all the time. The wife goes off with the car and the husband's home and he can't get to his physio. We have to fight for that support, and this should be a given. But there's this expectation that family will sort of pick up the slack in these spaces. You can also see in the supports and programs for people with disabilities that there's an expectation of relying on informal supports. So the Health and Community Services Program with the Government of Newfoundland and Labrador, for example, explicitly says that home support services include the provision of personal and behavioral supports, household management, and respite at the minimal level to maintain individual independence. And I highlight, home support services are intended to supplement, not replace, the service provided by individual family and or the support network. And this is certainly felt by people with disabilities. And you can see that reflected in this quote here by a person with disability. And she says, the social worker is like, do you have any informal supports who can help you? They use that to reduce your home support hours. So you got to be like, I got nobody. They'll ask about my biological family. They'll turn to my roommate who I just met, and they'll turn to my coworker. And I was like, you can't ask your boss to help you put your orthotic on. When the social worker comes, you got to take down all your pictures. Otherwise, they'll be looking at them for people who might be able to offer support. It was also evident in my interviews in particular that there's a great reliance on family supports on the part of workers so they can undertake work-related mobility. This person with a disability described her van and its importance in her ability to get to work. She says, with my van and everything, it's fine. Previous to that, I was using the early accessible transit system. And at that time, there was no accessible motor bus or accessible cabs. There were a lot more challenges then, obviously. Having my own van opens up so much more. And when I asked how she came to get her van, she says that she found out about a government grant that would cover up to $25,000 to modify a vehicle. And she says her dad at the time had a van because this is how she would get home. He had the van with manual ramps and he would pick her up. So when she found out about the grant, she approached her dad. So I got the grant and he gave me his van and we got it modified. It was a couple of $1,000s more than the grant, which we had to cover off, and the van we already had. So again, you can see that there's a reliance on family supports and family resources, such as this van belonging to her father, in order to undertake reliable transportation to work. And finally, this person with a disability notes her reliance on family support. And again, I'm defining this more broadly to include here a colleague of hers. And she says, me and my current supervisor, I've known her for a couple of years, and I try to think about the one moment when we became close, and I can't think of any because it happened so quickly. One moment I knew her and I was volunteering, the next I was employed, and after a moment after that, we were going to the farmer's market. I guess when you got a disability, you get good at networking, because if there's people who can help you survive. So to conclude then, the findings from my qualitative study really echoed the findings from my scoping review, which largely is that the accomplishment of travel to work is largely taken for granted in the research, as well as in work disabilities policies and programs. Additionally, we could see that transportation to work is largely considered a personal responsibility. And I showed you how work disability policies and supports seem to overlook work mobility needs and challenges, and the way those policies can introduce new travel-related challenges. And you can see here how family plays a critical role in the work mobility of persons with disabilities, and how both workers themselves and the system relies on these informal supports to support transportation to work. And finally, just some concluding thoughts on where we can go from here, and possibly work that we can do to develop and foster understanding of what it takes, including the effort, resources, and family for workers with mobility impairments to get to work. How can these workers be better supported through supported commutes, scheduling accommodations, and work from home? How transportation and related supports complement or conflict with one another and with the worker's circumstances, informal supports. And how we can develop understanding of transportation to work as a necessary part of doing one's work, and rethinking whether or not we consider transportation supports as being within the scope of some of these systems. So I want to quickly acknowledge the support that I received to do this work, the co-supervisors of this postdoctoral work, Catherine Lapel, who you've heard from this morning, as well as Dr. Barbara Neese. I want to acknowledge again the assistance of Kristen Rahm with my scoping review, and the funding support from CRWDP. So thanks very much.